Well, hello, welcome to our second election webinar that's being co-hosted by AIDS United and the National HIV Housing Coalition. My name is Christina Adeleke, and I serve as the Senior Policy Manager for Community Mobilization and Health Equity at AIDS United. Thanks for joining us for our second webinar in this webinar series, where we're going to be talking about the roles of government and the impact that elections have on those roles and how those roles impact our community. We're going to be hearing from two folks providing both a federal and state perspective on these issues. So I want to quickly introduce our speakers. We have Matthew Rose and Breanna Diaz. I think it would be great for y'all to briefly introduce yourselves, and then whoever wants to go first can go ahead and dive in. As we have this conversation, feel free to be dropping questions in the chat, and I'll be monitoring those, and we'll have some time at the end to go over those questions. Okay, so you want to introduce yourselves, Breanna and Matthew? Go ahead, Breanna.
Okay. Yeah, I'm like, direct me. It's so great being in virtual space with you all today. As I said in the chat, my name is Breanna Diaz. My pronouns are she and they, and I am the Policy and Legislative Counsel for ACLU of Virginia. So I work for the Virginia affiliate, and I'm based in Richmond, Virginia. But I've worked with Christina and Matthew in my previous role where I was more active in like the HIV movement, and I'm so happy to be like in space with you all again. And I'll be talking about state elections and state government, and as well as community advocacy. So happy to unpack that a bit later, and I'll pass it to Matthew.
Hello, my name is Matthew Rose. I use he, him pronouns. I am the Senior Public Policy Advocate here at the Human Rights Campaign. I've been doing federal health policy work, especially in HIV, for about the last 15 years. There's not a national HIV strategy that I have not had my fingers in, for better or worse, including some very awkward fingers. Thanks, Trump administration. But one of the great things about the HIV movement is that we won the big lot. We created systems and structures at the federal level to cover us across this country and maintain billions of dollars in funding for those systems. And so we have a lot on the line of who's in charge here, what they do, and are very well linked into what's happening at the federal level. And so I've been doing that work for the bulk of my career. I did most of it domestically, but also did some time in global. So I've gotten both sides of the coin.
Awesome. Thank y'all. So who wants to go first? I know we should have decided this earlier, but we didn't. So here we are. Who wants to go first? Matthew or Breanna? I think Matthew should probably go first, set the stage. Federal, that makes the most sense. And then we'll apply the supremacy clause. We'll go the federal first, and then state. All right.
I'm good. Let me cue everything up. Everyone see my slides?
Yes, but
Cool.
We can also see your notes.
It's showing you presenter mode too.
Yes.
Let me display settings. Just do thing. Sometimes when you have multiple screens, it's not as helpful as you think it is. All right. So as I mentioned, the federal response. We are all over the federal government. We have people in places. I'm going to cover a lot of the higher level folks. So working at principals at organizations and the functionality of those roles and what they kind of do in the federal response. But almost every piece of the federal government has a role to play, and almost every agency has a role to play in the HIV response. We tie this all together through the National HIV/AIDS Strategy, which is supposed to be this kind of everybody document, so both the government and community and the private sector, of what we all kind of collectively have to do. But when it comes to the federal government, we got people in places literally everywhere. Did it not? Come on. Why is my... Sometimes technology is not my friend. Sorry about this, y'all. It was working a second ago. Current slide. Don't show presenter mode. Duplicate slideshow. All right. So the biggest place where you'll see the most of our work is in Health and Human Services. The Secretary of Health and Human Services is the person who oversees the majority of HIV funding and the majority of HIV services. The White House and the OMB have a role to play. The other agencies do, but the vast majority of what we're going to see in terms of health directorates, in terms of insurance, in terms of coverage, in terms of HIV priorities, are all run out of HHS. Now, the Secretary every now and then will weigh in, often not, which is both to our lovely, we love it and we also hate it for them. But they do have the power, and they will have to sign off on any major thing that happens, including when we create big things like the Ending the Epidemic Initiative. For strange moments, I was sitting at a table with Alex Azar, folks who remember him. He was Trump's HHS secretary, and we were talking about how we're going to build the EHE plan, and he was into it, which was weird because they just wanted to not talk about, who needs healthcare, accessing healthcare, and any of those pieces, but they were going to end the epidemic. So the secretary can play a huge role. A lot of their roles and responsibilities when it comes to HIV, they deputize to other people. There we go. Aha! The place where we get probably the most out of at HHS is the Office of the Assistant Secretary for Health, known as the OASH. They set a lot of policy, and the Office of Infectious Disease Policy, say that fast 5 times fast, is located there. Currently, Admiral Levine is our current person who heads up this office. She has a strong mandate around HIV. She routinely visits HIV clinics around the country when she travels as just part of what she wants to do, above and beyond what else she has to do for other privileges and other responsibilities. But this office is where we historically, between when Assistant Secretary Howard Koh was there, when Brett Giroir was there, when Admiral Levine is there, this office, the Assistant Secretary's office, is where a lot of HIV policy comes from and gets processed through. If you want to get really nerdy right now, the HOPE Act, which some of you might be following, which is what deals with HIV transplants, that is coming out of that office. So really important piece. Office of Civil Rights. People forget about this office when it comes to HIV response. Critically important, because any sort of violation of your healthcare and your civil rights in the healthcare setting is handled through this office. So any complaints we have about discriminatory plan designs, so some plans try to limit the amount of HIV medications that can be on formulary. So say, we shouldn't have to cover all the drugs, and we're like, yes you do, all the time, until we tell you you can't. This is the office that would follow up and sue that plan or enforce compliance against that plan. So currently, we have a great champion there, Melanie Fontes Rayner. We also think that both her and Admiral Levine will stay if Kamala wins the presidency. If not, weird things happen. So in the offices and secretary, we were lucky last time to have Admiral Giroir, who did care about HIV. He did pediatric AIDS in his younger years, and so he was there for us, except for that whole, I don't know what I'm going to do about LGBTQ people, and I'm not sure that women need healthcare part, which is kind of weird when you're trying to solve a health problem. But we do get some people on the Office of Civil Rights that totally flipped on us. And we got these crazy people who kept trying to find religious exemptions not to provide care to our community. So it gets bad when it flips. The HRSA administration. So HRSA has the Bureau of HIV/AIDS. The Bureau person is not a political appointee. Laura Cheever currently holds that position, but she reports to the head of HRSA. And they also not only oversee the Ryan White program, but they also oversee BIBIC. They also oversee the workforce. So anything that is done with care generally goes through HRSA. So the HRSA administrator, really important for us. Also, Bureau of Primary Healthcare, that is a political appointee. That person does stay. Currently, it has been Jim McCrae, who has been this person forever for us. He's been a fan of ours. He's been working to make sure that the community health centers do cover the needs of people living with HIV and the people who are vulnerable for HIV. It's been very helpful to have them there, especially because Republicans generally, not all of them, like the Bureau of Primary Healthcare. especially on the Senate side, because everybody has health centers. And so everyone has a vested interest in keeping them. Now, certain MAGA Republicans want to cut those and we'll lose people there. Problematic. NIH. If we want new stuff, it's got to come through NIH for the most part. Sometimes the drug companies will do trials on their own. More increasingly, they want NIH to be the people who pay for those trials and for those very large-scale trials. And so having the head of NIH, who's the only real political person over there, that is somewhere which has been really helpful for us. Historically, we have got the tap of whatever the budget for NIH is, has been allocated to HIV, which has been really helpful. That has gone away. We continue to push to get that back. But for new treatments, for new prevention, and for our cure research, all of this is done out of NIH. And what NIH decides to prioritize, decides what we do research in. CMS. So most people don't pay attention to CMS. CMS is critically important. Most of people who get HIV services who live in low-income settings get all of their healthcare CMS. CMS is the largest provider of HIV insurance in the country. And when CMS makes a decision on something, it is nationwide. Now, there are some things, and that Breanna will probably be able to tell you about what happens when the states decide to do their own stuff here and state matching. But for the most part, what CMS says goes nationally. So PrEP has to be covered. HIV services have to be covered. There has to be a viral load on file. There has to be an appointment visit. There has to be a record of people picking up their meds. If we get CMS on board in places that have expanded Medicaid, we've seen much better outcomes for people living with HIV. CMS, critically important role in this. There also, you have to drag them kicking and screaming to the table. Oh, and the insurance exchanges, so all the Obamacare insurance exchanges, all of them are covered through CMS. Centers for Disease Control. Now, everybody knows HIV and CDC. What you don't know, most people don't know about CDC is CDC only has one political appointee. So one person gets picked by the government, everybody else, or is picked by the administration, everybody else there is career. Until this year is going to be a little different than normal because Mandy Cohen, who's our currently head of CDC, if she stays, everything's good and copacetic. If she leaves, new regulations will require that the director of CDC becomes the Senate confirmed position, which means the Senate has to weigh in. So of all the positions we've talked about so far, only the Secretary of Health and the Assistant Secretary of Health have been Senate confirmed. Oh, actually, in the CMS structure, Senate confirmed. But when these people get Senate confirmed, it lets them get more politicized in some ways. But if we win and she stays, we don't have to deal with this until next time, which will be nice. But in terms of prevention services, in terms of surveillance, in terms of grants and funding of health departments, all of that happens through CDC, incredibly important for just making our lives work. And in cases where the states decide to do something that we don't like, Tennessee, CDC can grow and decide that they can put plans in place to mitigate those factors. So if states start going rogue, CDC also plays a role. But CDC also needs to do everything in conjunction with the states. They have some authorities federally, but as you probably saw during COVID, they're not all powerful, despite what the certain MAGA Republicans would tell you. It is a very important relationship with the states. Other places that we show up that people don't think about. HUD, the HUD secretary, incredibly important to us. Why? Because housing is healthcare. One of the most requested services by people living with HIV is housing. Our HOPWA list is almost always our longest list of trying to get people opportunities. And we know that if people have stable housing, they have better health outcomes, both on the prevention and the care side. So really important that we work with these folks. And especially as people are talking more and more about housing, it becomes critically important for us in not just like housing, but like housing that has co-located services. So like having a HUD secretary who thinks that there should be health services near housing, that becomes really important in how people get health outcomes taken care of and prioritizing that rather than saying we should just prioritize building a bunch of houses in the desert or on 1,000-year floodplains. The VA is always an interesting one. It is the largest single provider of people living with HIV as a healthcare. affiliate because the VA centers are all linked. So they're the largest system. So not Cigna, not Blue Cross Blue Shield, but the VA. The VA also does a lot of work on the prevention space. The VA secretary can decide to push policy forward that is better for people living with HIV. The VA also generally provides better health outcomes overall for people living with HIV. So we like the VA when they're working for us. Sometimes the VA is slow. Sometimes the VA is not everywhere we need it to be. And sometimes the VA just forgets about us. But when they do work with us, they actually do a fairly good job. DOJ, two important offices. The Attorney General, really, really important. They set the tone for literally everything. But the Office of Civil Rights, also really, really important. So for, again, Tennessee, our favorite problem child state, the Office of Civil Rights is currently suing Tennessee off of their discriminatory policies towards people living with HIV. They are also the ones who put in a budget request that we should have money to overturn HIV criminalization laws, which is one of the few, and that they should be able to sue states over some of their HIV criminalization laws. Now, HIV criminalization is mainly a statewide issue created by our federal mandate, but we have to work in conjunction to overturn these, and having an aggressive DOJ is really key and critical to that. Office of Management and Budget. These folks decide the money. They put up the president's budget. I will tell you the fun game is that no president ever gets all of their budget. Mostly Congress says, that's nice, but probably not. However, those numbers do become critical parts for negotiations with members of Congress. And if a president doesn't support a number, it's much harder to lift that number up. Now, our community has done this before, but having an OMB on your side is really important. And OMB also reviews all of the kind of administrative rules and sub-regulatory guidance. So any guidances or rules that they put out, say like, I don't know, allowing PrEP to be covered by certain various components, or saying that HIV programs have to be included in certain directives. All of this has to be reviewed by the Office of Management and Budget, and they decide. Next is the Domestic Policy Council. They set the agenda for the White House. This is another position that they just appoint. They don't have to have Senate confirmation. Under the Trump administration, a person on the Domestic Policy Council handled HIV for us. In all Democratic administrations and Republican administrations prior, the Office of National AIDS Policy sits on the Domestic Policy Council, and they set the HIV agenda. The Trump people were a weird aberration. We don't want to go back to that because the person who was there had some weird feelings about other health issues. I believe she thought that birth control caused abortions. So like we just don't need those people back in office. But the Office of National AIDS Policy, they set the strategy for the country and try to then make all the administrative agencies work together on that strategy. And they try to keep people coordinated and then set big meetings. So Francisco Ruiz is our current person in this role. He just had the first ever National Summit of Latinos on HIV at the White House this last month. And continues to be able to bring focus like that. They have a mandatory convening power. They can sometimes get the drug companies to listen to them. So very important role, sets policy for us. Global side. So global HIV is handled, most people think of it at State Department, but it actually gets handled by a couple different places. So at the State Department, we have the Office of the Global AIDS Coordinator, who is considered an ambassador level position. So they have to get confirmed by the Senate. They're now under the Office of Global Health Security, which is another ambassadorial role. Also gets confirmed by the Senate, but they oversee PEPFAR, which is our $6 billion global program that provides President's Emergency Release for HIV AIDS around the globe. Really important program, has reduced global HIV deaths by a whole lot. We saved an estimated 25 million lives through the PEPFAR program. CDC has roles and helps give technical assistance around surveillance work globally. The NSC sets a lot of foreign policy directives, and so they weigh in. There's a health directorate at the NSC on global health and the global health security directorate at the NSC. Both of those intersect with HIV. I forgot on this post, the US military has some role in HIV, especially globally. They have historically, the Army, for instance, set up field hospitals. We give out medicines. We did a lot more in response. And the only HIV vaccine that has ever proven somewhat efficacious came out of the US military. And the USAID does technical assistance. They both have a global health directorate and have an HIV bureau. Both these places get appointed, but are very important positions in the global response. All right, that is the nutshell of the administration. Now to Congress. Congress, I'll go very quickly through these. It's just you have your Senate minority majority leaders, and you have your Speaker of the House. All these folks basically set the agenda. They have regular meetings, and sometimes they are helpful to us, sometimes they are not. Mitch McConnell's office is randomly helpful to us on global AIDS. Mike Johnson's office is randomly not helpful to us on almost anything. Hakeem Jeffries, who hopefully soon will be Speaker Jeffries, has had a strong position on HIV/AIDS over the years and continues to be supportive. And then Leader Schumer has been mostly supportive, although gets bogged down sometimes. But New York does push him pretty aggressively. Appropriations chairs, Patty, we have our first time in this Congress, and hopefully continue next Congress. We have 2 women running the appropriations process. It has been smoother in some ways. Nothing we've ever seen before like this. Patty Murray has a long history of supporting HIV domestically and doing so globally. Susan Collins has done a lot of work on global, has done more work on the global side, but also done stuff on the domestic side. Tom Cole, who's the current appropriations chair on the House side, he supports HIV, especially for Native communities. He, however, is a good soldier, is probably the best way to put it, and does whatever leadership tells him. And so if leadership says you're making cuts, he'll make cuts and then tell you he's sorry about them later. Rosa DeLauro, amazing chairwoman. Can't wait for her to be back in the chair and have the gavel, has been very supportive of our programs, also oversees the Labor H bill, and so she oversees the bulk of HIV funding in Congress. On the policy side, you have on the Health Committee, you've got Chairman Sanders, who is always trying to kick the drug companies in the teeth, which is great for us because HIV drugs cost way too much money, and we need to bring those costs down. Strangely enough, Bill Cassidy is actually one of our more supportive Republicans on HIV. He was a gastroenterologist, so he knows some things about the gut biome, and we'll talk your ear off about it. But he has been better and understands HIV, and even when he wasn't on appropriations, has tried to help to weigh in on the HIV response. Senate Finance, strangely, it's the Finance Committee that oversees Health and Human Services. That is because of the earned benefits programs that are over there. So when you're looking at Medicaid, Medicare, all of that and all the mandatory programs fall under finance. So finance gets pulled into this. Ron Wyden has been good for us. He's been very good for us on PrEP. Mike Crapo, I have nothing nice to say, so I'll just keep moving on. I will say Sanders, Cassidy, and Crapo are not up for re-election. Wyden is, but Wyden will cruise re-election because it's Oregon. Catherine Morris Rogers is coming off and retiring, so there will be a fight on ENC to see who replaces her. Frank Pallone is staying in. He has done good work for us on HIV in the past. Steve Womack is, I will let Lauren Banks tell you about how she feels about Steve Womack. One of the things that's not here is that Jerry Nadler, who heads up Judiciary, is also a big housing supporter and has helped us immensely over the years and has usually got the New York delegation to get more money into HOPWA for everybody. Mike Quigley has been great for us. He's amazing. And that is everything. I'll stop sharing and pass it over to the fun things that happen on the states.
Awesome. Thank you so much. All right, Breanna, it's your turn now.
Yeah, no, it's a great presentation to follow, and I appreciate that in-depth dive into what's happening at the federal level. Once you stop working for a national, it's like it doesn't exist. So that was really educational, informational. So appreciate it. Okay, I'm going to share my screen. Apologies if you see 1,000 tabs or chats. All right. How do I use you? Okay. Present. All right, can folks see my screen?
Yes.
Perfect.
Yeah.
Thank you. Yay. All right, let's see if the ACLU tech works. So again, I'm Breanna Diaz. My pronouns are she, they. I'm policy and ledge counsel. We're at the ACLU of Virginia. I oversee our LGBTQ rights, reproductive freedom, and First Amendment as it relates to book bans and classroom censorship, but work here in Virginia. But historically, I've worked for the incredible organizations like the Positive Women's Network USA, an organization by and for women and folks of trans experience living with HIV. I was there for 3 years and got to oversee so much of their HIV policy, priorities, and agenda at the federal and state level. And actually used to work at HRC doing LGBTQ advocacy. So this type of advocacy, both at the national and state level, are deeply important to me as like a queer person of color who is directly impacted by the outcome of elections, as well as policy and regulatory action that is taken by my representatives. And so I think it's really important to know what your federal and state government representation is, how do state, federal governments operate, what is the impact elections have on key offices or even issues on your ballot that impact your day-to-day lives, and how community advocacy intersects with these systems and electoral outcomes. So I will be offering a very general overview because every state is so different and I really can't speak to all in each state. You will know best how your state works. So I am here to offer kind of like a generic overview, but we'll focus in on Virginia, the state I am most familiar with, or the Commonwealth I am most familiar with. But if you have any questions or comments about your particular state's system, drop them in the chat. I'm sure Matthew, Christina, all of us are happy to share our respective knowledge and answer your questions. So I'm going to go over what I just said. I got really excited and ahead of myself, but we'll do State Government 101, state elections, and then I will try to demonstrate this information around a case study here in Virginia. I might tack on another case study that is specific to HIV criminalization. We'll see how timing goes. But quickly, so ACLU of Virginia, I know I've said that name 1,000 times. I'm sure most folks are familiar with ACLU, an organization, a national organization that's about 100 years old now. But in addition to national, there are 51 or 52 affiliates across the country, one in every state. California gets 2, and ACLU Puerto Rico. We are autonomous entities that get to oversee our state's like policy agenda, our litigation agenda, and other types of issue-based campaigns. So I work for ACLU of Virginia, and our affiliate has been in existence for nearly 60 years. Its formation came after the landmark decision, Loving v. Virginia, which struck down laws prohibiting marriage, like interracial marriage. And much of our work is focused on policy advocacy, litigation, and organizing. And so I will demonstrate that as well through this presentation, through engaging with state government elections, and then again, the case study. But wherever you live, there's an ACLU, and you might have worked with them, or maybe you haven't. Say hi. Some of them are cool. I'm just kidding. They're all pretty cool. But State Government 101. So I know Matthew just walked through, what executive actors there are, as well as legislative actors that impact impact issues impacting folks living with HIV, right? So starting with, who sits in office, what is their stance on things like, access to housing, funding particular programs, lowering drug costs, like pushing, opposing HIV criminalization, who occupies office in both the executive, so think president, vice president, as well as the legislature, so Congress at the federal level. Those leaders, those representatives matter and make those decisions. That same framework exists at the state level, of course, to a degree and with caveats, but generally, all state government, each state has its own legislative branch, so that's Congress, an executive branch, typically, again, like president, vice president, and executive agencies like Health and Human Services, like Department of Education, and many others, as well as a judicial branch, which is your court systems. And so states are empowered to pass, enforce, and interpret laws. Of course, as long as they do not violate the US Constitution, but I like to put like an asterisk there that is like, well, who gets to define what violates the US Constitution? Because that is constantly changing with this judicially activist Supreme Court, right? And so, like when you are doing state level work, if you are somebody who does state level advocacy, like with your legislature, I'm sure you are familiar with advocating for particular pieces of legislation. I think one example that stands out is HIV decriminalization or HIV modernization, right? We know that in addition to federal laws regarding HIV criminalization, I can't remember the exact number, but I know there's many states that still have HIV criminalization laws on the book. And so there are efforts led by organizations like AU, HRC, Positive Women's Network, Transgender Law Center, so many more partners like the US People Living with HIV Caucus, working state by state to either completely rescind those laws or modernize them. So amending existing law to make it much more difficult to charge people with HIV criminalization, as well as to lower the types of penalties and like registry requirements that many states have. So those like state efforts happen at the state level and typically through your state legislature. That's just one example. And again, want to just reiterate that these three branches of government that we might be most familiar with at the federal level do exist and within every state as well. So I think just to like build on that a little, every state legislative process is different. And so what I mean by that is, how many members are composed like your state's respective House of Representatives or House of Delegates, like I have here in Virginia, as well as like your state Senate. How many members are composed there? Like, what are the various committees within the Senate and House, right? Like, there can be so many different committees that are convened to oversee particular issues, like some of the committees that Matthew had named, right? Where Senator Sanders chairs the HHS committee. We have a similar committee here in Virginia in our Senate and House. So like what exists, how often they meet, who composes those committees and assemblies really is going to be based on your particular state. Another difference between every state is like when do your legislatures meet, right? Here in Virginia, our legislature meets every year. But for how long they meet depends on if it's an even or odd year. If it's odd years, it's 45 calendar days. If it's even years, it's 60 days. But then we look at states like Texas, where their legislature only meets every other year. We also see a difference in how long those sessions exist for, right? So I just said like Virginia's is 45 or 60. Texas's, maybe they only convene every other year, but it runs the full calendar year. I think New Jersey is the same, where it runs like a full calendar year. And so it's really important that when you are engaging in state legislative advocacy, know what your legislative process is, know what the key dates are. Like when does session convene? When is the cutoff for pre-filing or introducing a bill that is important to you? I know here in Virginia, we have something called crossover, where that requires a bill starting in one chamber, say the House, must get out of the House and cross over to the Senate by a specific date, because if it does not meet that deadline, the bill automatically dies. This is all information, procedural information that is critical to the success of your campaign, right? Now, in addition to knowing your process and just generally noting that every process is different, states can be quicker to respond and be more willing to experiment with policy ideas. I think we see that again, like looking back at like HIV modernization efforts, like a lot of those efforts started at the state level. Another example that I know I'm more familiar with now is, and I'm not sure if folks are familiar with this, but like shield laws and what those briefly, what those are is that following the Supreme Court's decision in the Dobbs case, overturning Roe, which recognized a fundamental right to abortion, quickly, many states had either immediately implemented or following the Dobbs decision, outright banned abortion and criminalized patients and providers in many circumstances, or substantially restricted it, right? I know here in Virginia, we actually are the last abortion access state in the entire US South. And so what we saw was like an outcome of those bans and those restrictions that criminalize patients, providers, and those assisting individuals seeking or receiving abortion care is that we wanted to ensure that access states like Virginia, like Washington, like New Mexico, Pennsylvania, New York, that all of those states that were now receiving an influx of patients seeking abortion care, that those patients leaving a ban state to an access state, that their medical records, that their digital privacy, so how they use social media, how they talk about like how they're going to schedule the appointment, who drove them to the appointment, how all of that is protected from ban states that might want to pursue criminal action for those individuals. Those shield laws are new, they are experimental, they've only been around for about 2 years, and more access states seek to adopt them, but really have not yet had the opportunity, which I think is, you know, a good thing in a way, to test them out, right? But that innovative response to this horrible political and social reality that many are experiencing, that they cannot access healthcare, that is an example of an experiment with a policy idea that maybe at the federal level may not be possible due to the political makeup of Congress and the president's office, or has like other hurdles that make it less likely or a further off goal to achieve. So much can be accomplished at the state level. Finally, in state advocacy, local advocates and organizations drive the agenda. Of course, there are private interest groups, there are big donors and big funders and lobbyists who get to decide much of what your state representatives introduce and lead. But I will say that as someone who has historically worked for community-based organizations, as well as being a community advocate myself, I have seen greater success in moving and working directly with members at the state level than I have at the federal level for a multitude of reasons. And so I think it's really important to be active in your state government as well as your local if you really want to see changes that impact your day-to-day life. Oh, I kind of got ahead of myself again, but this was to give you an example of of like how the political composition of your executive, legislative, and judicial branches result in like a patchwork of policies and laws. And so this is a map that shows what current abortion bans and restriction laws are across the country. You can see in orange, all of those states have the most restrictive, if not outright bans, where you see in like the blue shades, states with protective, very protective, or more protective laws regarding access to abortion, right? So, I mean, you're in Virginia, we have restrictive, we're coded as restrictive. I won't go on a tangent about why that is. It is accurate. But then you look to our north, you see DC and Maryland, and they have protective. But then if you go to West Virginia, it is almost a complete ban, right? So again, how you engage in your state and like the state policies that exist will vary, but it is important that you engage nonetheless. And then just to be like consistent around terms, that I know we've been throwing them a lot out. So when we talk about the executive at the federal level, we're typically talking about the president. When at the state level, we're talking about the governor, right? The governor usually signs bills into law, but of course there's like veto, pocket vetoes, etc. But typically that's the role the governor plays. At the local level, you may have a mayor. The higher legislative chamber is typically, you know, the U.S. Senate at the federal level. At the state, it's the Senate. And then at the local level, you might just have a city council or a board of supervisors. And then again, the lower legislative chamber in the federal government is the U.S. House of Representatives. In the state, it's usually your House or Assembly. For me in Virginia, I have a Senate and then I have a House of Delegates, and that makes up the General Assembly, right? So just being familiar, this is just to demonstrate how local, state, and federal systems mirror each other regarding the executive and the legislature. And then I have this really ugly chart that the Virginia government was like, this is a great way to get really complicated information out, right? We love that. But the intent here really is to, I think, further drill down onto what entities and agencies fall under the respective branch, right? So here in Virginia, we have the legislative branch, which is what I said is like our General Assembly, but as well as our Office of Attorney General, who you vote for. At least in Virginia, we vote for ours. And in the judicial branch, we have our state court system. We have our circuit courts. We then have a court of appeals, and we also have a Supreme Court of Virginia. And then again, for the executive branch, we have our Office of Governor, who oversees all of our executive agencies. And we have, we have the Virginia Department of Health, we have the Virginia Department of Education, we have Agriculture and Forestry, we have a Department of Transportation. Many of the executive agencies that exist at the state level mirror those that exist at the federal level. Of course, there is variation in names, amounts of agencies, and what falls under their purview, but this really is just to provide an example of how these things mirror and map. So state elections. So what we mean here, what I wanted to name here is, building on what I just laid out, right, is about how our state systems and government are set up, who are key actors. And I gave a couple examples about how your state environment, right? What is your political composition? How does that impact your policy, like your policy advocacy or your community advocacy and the laws that define your state? And so, I think it's really important to know your ballot, know who's on it, know where they stand, and like, what does your state actually allow for you to vote on? And so at the state level, typically your ballot's going to be composed, like, depending on the election year, right? Because like these officials are not up for election every single year. They typically serve an X amount of years per term. Like, for example, our governor serves 4 years. Our senators serve 4-year terms. Our delegates serve 2-year terms. So our governor and senator are up every 4 years. Our delegates are up every 2 years, but those elections actually don't always match up. So just so you know, Virginia is the only state that has elections every single year based on how our federal and state officials are placed on the ballot. Like, we truly have elections every single year. So it makes electoral work real fun. But at the state level, you might usually see your governor or your senator, representative, or delegate. And sometimes you'll even see judges. A lot of states do allow for their citizens to vote for judges that sit on state courts. I know you can also vote for, here in Virginia, we have Commonwealth attorneys, or those are like district attorneys. You can vote for who represents you, which attorney represents you, right? At the local level, you will vote for like your board of supervisors or city council. But you can also vote for school boards. Unless you're in Virginia, where 13 of our school boards are appointment boards, and that's actually a carryover from like Jim Crow era, right? So like very problematic, very racist process or system where only the board of supervisors gets to seat school board members, shields those school board members from any community accountability whatsoever. But anyways, noting that it's important to know your ballot for the state elections, for the federal elections for sure, but also the local elections. It is so important you vote up and down ballot, consistent with your personal values, because folks that sit on the board of supervisors, folks that make up your school boards, they really determine what your like day-to-day life looks like. For school boards, a lot of our fights right now are regarding policies seeking to target transgender youth, right? We're seeing a lot of policies introduced in Virginia and across the country that would empower school administrators and staff to dead name and misgender students, to forcibly out them, to like prohibit them from forming, supportive student clubs, and so much more. We're also seeing a rise in book bans. Sadly, Virginia is I think the second highest state with individual book challenges or books seeking to be removed from public libraries or public schools. Texas is the only state that beats us. Those determinations on what books are available in school libraries, are a part of class curriculum. Those decisions are made by your school boards, unless your state has like some other weird law. But here in Virginia, our school boards determine that. And so it is so important that you know who's on your ballot and that you vote for values aligned candidates. Finally, you will also see issues or like referendums on your on your ballot. And an example of that is the reproductive freedom constitutional amendments. We saw several years ago 2 states following the Supreme Court's decision to repeal Roe, annihilating that fundamental right to abortion. States then passed constitutional amendments recognizing in their state a fundamental right to reproductive freedom. And that had to be a citizen-initiated referendum to put it on the ballot. And then it went to those citizens of those states, Michigan and Ohio, for them to determine if they want to amend their state constitution to recognize a fundamental right to reproductive freedom. Both of those constitutional amendments in those respective states passed. They were adopted. Those are the 2 strongholds for reproductive freedom, in addition to Vermont and California. And just this year, in November 2024, 10 more states are taking those on. Virginia is set to take that on, if everything goes according to plan, in November of 2026 based on our system. So it's really important to know what issues are on your ballot because they also impact your day-to-day and are tied to the powers and purview of your state government. And then I was going to go into a case study, but I think I rambled enough, so I will stop there for comments and questions.
You were not rambling. You were like giving so many great facts, both you and Matthew. Like this was super, super informative. And that's saying a lot for someone that does a lot of this work. I was like, oh, I need to get these slides. Stay informed. Who has questions in the group? Wait, let me take off presenter mode or the spotlight because I can't see.
I don't necessarily have a question, but I am super grateful that you all broke it down in like terms that is understandable. Because a lot of times we have like information overload. So I appreciate you both. Like I was like scrambling, writing down everything y'all were saying. So like I appreciate y'all breaking it down to where we can understand. It's great for policy literacy.
Yeah, you definitely need more of these kinds of sessions.
No, I'll say from, we both mentioned it a little bit, but that interplay of the states being the test cases does happen quite a bit. Like something happens in a state and then it bubbles up to the federal level and then we push it forward. But it's also because of, as Breanna mentioned, like because so many of the state legislatures move faster because you got 60 days to figure it out. You can get something implemented and tested faster. Like I will tell you, Congress is not always the place where things go to move. You could be working on things for years, but sometimes at a state level, you can test something faster and then elevate it. And sometimes even then get like your champion from the state level to go to Congress and continue elevating it.
Yeah, and that's an excellent strategy to help build momentum on that issue, especially if it is a newer issue. To see it happen on the states, other states get jealous. They're like, oh no, we should have that. Oh, they're getting funding for that. We need to be getting funding for that. It's just like, okay. And that's momentum at work. So are
I
there,
have a question.
oh, go ahead. Go ahead.
Oh, hi. Oh, come on, camera. Hi. I'm Lawrence from Detroit. Thank you all for your presentation. I thought it was amazing. I just wanted to, I don't remember whose slide it was on, but one of the slides said that abortion is an LGBTQIA plus issue. Can you expound on that for me just a little bit?
Yeah, happy to. And fun fact, that's actually
Thank
me
you.
holding that sign, and those are my nails. But like, I think what I mean by that is we know that um, bodily autonomy is an issue that impacts everybody, right? The decision to when and how to have a family, access to reproductive health care services, whether that is, to have an abortion and seek abortion care, or whether that's finding quality, competent, affordable healthcare providers that serve LGBTQ people and our unique needs as queer and trans people. That is reproductive justice. That is reproductive health. A lot of the work that we pursue at the ACLU, and I know many other orgs here, our advocacy is not only rooted in rights, but as well as justice. And we know that access is necessary to really see the full implementation of a right. And so when I think about LGBTQ folks and our ability to form families, the fact that even we need or want abortion care, we have to ensure that we are addressing restrictions to that care. Again, whether it's cultural competency, whether it's literal bans to that care, those are all issues that impact us as well.
I will say this,
Thank
at
you.
NHAHC, it's one of the big things in my portfolio is reproductive freedom and access. We are part of a number of coalitions on this. We've hosted folks over here, and we remind Congress, one, women and people who have reproductive abilities exist, just straight up, and everyone should have access to those things. But even some of the fundamental issues at stake for abortion play over to ours as well. Like just I need a medical procedure because that is my life, and I should be able to make decisions about my medical life with my doctor without some weird politician poking their head in between and telling me that. Like that is exact in similar language. We see this around gender affirming care. We see the fights for abortion, and if actually, and from the global perspective, when abortion goes down, access to abortion and gets more restricted in countries, and women's rights start falling, you start watching this democratic backsliding generally happening. So it's often a canary in a coal mine situation. And places where we are expanding it and it's more free and there's more access, we are seeing usually an expansion of rights in these places.
Thank you both. Thank you so much.
Are there resources available for advocates who want to get more information about what y'all covered, just in their, to help support their own advocacy, maybe websites, blogs, anything?
I mean, if you want to get super, super nerdy on how government functions and work, I recommend the Center for Budget and Policy Priorities. They will go deep on, and they do deep on just how we budget and how we spend things. What people often say is, if you want to show me your value, show me your budget. And it's very true.
Yeah, I would say for state, it's slipping my mind now, like one good state resource that breaks down all of these issues. I would recommend you can Google your state's ACLU. It's truly just going to be ACLU dash your state's initial. So try that. All of our affiliates and our national, if you want to go to our nationals page, are active in the 2024 election. We have information up about where candidates stand on civil liberties and civil rights, as well as ways to volunteer for federal and state campaigns. So I know it's a bit of go find it, but it really is specific to your state. So I highly encourage you reach out to your state reps.
I just want to shout out the ACLU. They created, I think it may have been the national group, but they created such an amazing election resource that helps break down, every single, federal office, every agency, and how the election impacts, and it breaks it down by issue too. So you can talk about immigration, abortion, and it shows how each of these roles are impacted in that specific policy area. Right. Yeah, Agnes dropped the link. It's so cool. I thought that was so great and well done. And I'm so happy that resource exists and that y'all are doing such amazing work on both the state and federal level. This was so great. Any final questions before we officially close? Excellent, excellent, excellent. Well, thank you again, Breanna and Matthew, for joining us, and thank you all for attending. We will be, of course, recording all of these webinars, and they'll be available on the Election Center. All right, have a good day. Bye.
Bye,
Have a
everyone.
great day, everyone. Thank you.